Hey folks, Christian Brindle here, Medicare health plan expert and specialist, and today I'm going to walk through with you everything you need to know about getting onto Medicare, turning 65, potentially retiring, and what steps you have to take to get your Medicare straight and how to get everything set up exactly the way that you want it to be. So first things first, let's say you're turning 65 and you're getting onto Medicare. Well, when you're turning 65, there is actually some scenarios where you do not have to take Medicare at age 65. Opposed to what any of the commercials or advertisements that you're getting bombarded with might want you to believe, there is a situation where you can postpone taking Medicare at 65. You don't actually have to take it right away in some circumstances. And that circumstance is if you are either working or your spouse is working and maybe you're covered as a dependent with an active employer and you have group coverage through that employer. If you are being provided insurance from your employer through a group plan, you oftentimes are able to postpone Medicare because in the eyes of Medicare, that is deemed as credible coverage. Now, a retirement plan does not work. It has to be through an active employer. A marketplace plan would not suffice. COBRA would not suffice. It has to be an active group plan through an employer that you're currently working for on a full-time basis, okay? So this is a scenario that you can postpone Medicare if you meet that certain criteria and you don't have to take it and you will not accumulate any late enrollment penalties by doing so. Most people don't know that. Now let's say that's not the case for you, or maybe your group plan is very expensive. It would save you money to get onto Medicare. So what does the whole process look like? Well, the best way to understand it is there's two pieces to Medicare that work like two pieces of a puzzle that fit together to provide you with medical coverage. So there's actually these two parts of Medicare are the only parts of Medicare that come from the government. You have what's known as Medicare Part A and you have what's known as Medicare Part B. Medicare Part A typically is going to come at no additional cost to you. It's going to come at a $0 monthly premium as long as you've worked in the country for at least 10 years of your life or 40 quarters, either you or your spouse. Now, if you take Medicare Part B, which most people do when they're going to get on Medicare, you are going to have to pay a monthly premium for that. In 2023, at the time of recording this, that monthly premium is $164.90 a month. If you are in a larger tax bracket, they can potentially charge you more for that. We call that IRMA, income-related monthly adjustment. But for anybody that's outside of that high income bracket, normally if you're married and filing your taxes jointly, that would be under about $190,000 a year, and they base it off of your income 2 years prior. That is essentially Medicare from the government. Everything else you've ever heard about comes from independent individual insurance companies. And so everything you're going to be looking at with Medicare kind of centers around original Medicare Parts A and Part B. Now, A and B together, what does it give you? Like I mentioned, it gives you medical coverage, but it does not cover 100% of medical coverage. Part A covers hospitalization, Part B covers medical. And there's a litany of different things that fall into both of these categories, but there is some out-of-pocket that's left behind for you to pay. So Medicare Part A has a deductible, and that would be essentially if you were inpatient hospitalized. Medicare Part B has a deductible of about $226, but in addition to that, after those deductibles are met, you typically are going to be met with a 20% coinsurance that's unlimited. Medicare also doesn't cover things like prescription drugs, dental, vision, or hearing. So those are the holes that you're trying to fill. Having Medicare completely by itself is oftentimes not going to be in your best interest. So there are two different kind of plans that exist, different kind of ways that you can structure your Medicare in order to fill in these holes and fill in these gaps for you to be able to get the more complete coverage that you might be looking for. You have what's known as Medicare supplement plans, and you have what's known as Medicare Advantage plans. Medicare supplement plans work something like this. You pick up a secondary insurance company plan, and it's going to fill in the 20% gaps and pay the deductibles if not most of the deductibles that Medicare leaves behind. Think of it like a secondary insurance. It's going to pay if Medicare pays. That usually, depending on where you're located, will run you anywhere between $100 a month to maybe $200 a month. It just depends on your location and the insurance company. Now, those plans do not cover things that Medicare doesn't cover. So since, like I mentioned earlier, Medicare doesn't cover prescription drugs. Medicare does not cover dental, vision, or hearing. So you typically have to pick up separate plans to pick those items up. Think about it like your car insurance and your homeowner's insurance. usually you're going to have two different policies for those plans. Now, sometimes you can bundle them and things like that, but you kind of get the picture. Medicare supplement plans, or Medigaps as they're also commonly referred to, don't pick up anything that Medicare doesn't pay. So think about it like it's going to be a secondary for your medical coverage, and that is it. On the Medicare Advantage side of things, you're typically going to be, instead of supplementing your Medicare, you're going to be running your Medicare through a private insurance company. Think about it like they're administering your benefits for Medicare. And Medicare, in exchange, funds the insurance company every month to take care of you. The reason why they do this is because it takes a huge strain and burden off of them not having to pay this 80%. Everything's going to flow through the insurance company. And Medicare Advantage plans provide you with medical benefits, dental, vision, hearing, and Part D prescription drug coverage. It's like an all-in-one plan. This will be far more similar to what your employer coverage might have looked like or any other insurance you've had throughout your life. Now, with Medicare supplements plans, between Medicare and your supplement, you're going to have close to full medical coverage and no networks. As long as the provider accepts Medicare, you're able to use any insurance company Medicare supplement plan you want anywhere in the country. Nowadays, about 98% of doctors nationwide accept Medicare. Now, Medicare Advantage plans are more restrictive. They have networks of hospitals and doctors, and you have to stay within their network. Some plans have bigger networks, some plans have smaller networks, but you have to just make sure that you stay in the network and pick one that's going to cover your certain providers, okay? Now, Medicare Advantage plans also have copays. They don't typically are going to have deductibles, although some do, but most do not. You're usually going to be looking at copays. So your copays as you go. Think maybe $0 to $5 for a primary care doctor visit, potentially $20 to $30 for a specialist visit, and things like that. And then you're going to have maximum out-of-pockets over the top that are your safety blankets. So there's a little bit more potential for out-of-pocket, but both plans are incredibly good medical coverage. There's really no wrong decision as far as I'm concerned. It's just dependent on your needs right now and your preferences right now. And now you should be considering both options. You should be considering Medicare Supplement and Medicare Advantage plan and trying to determine which one is better for you. You cannot have both. This is the decision you have to make. And if you can determine which one of the two that you like better in 2023 when you're getting onto Medicare, that is 80% of the difficulty right there. Everything you've ever heard about when it comes to Medicare falls into one of these two categories, Medicare Supplement or Medicare Advantage. My office is actually located in Salt Lake City, Utah, but we're licensed in 46 states, and we can help you make this decision. We're licensed, contracted, and appointed with a myriad of different large insurance companies all over the country, and we can help you make this decision much easier. We can help you shop your options and save you countless hours of research time by doing so. If you'd like to work with our office number can be found down in the description of this video. If you found this video helpful and insightful, I hope that you did. Make sure to hit the like button so more people like you find this information easier. Make sure to comment your questions down below. We will make sure that we answer every single one of them. And make sure to subscribe for more Medicare and insurance-based content going forward. Thank you so much, and I wish you happy searching in solving this Medicare puzzle for you, and we hope that we were able to provide some clarity in your search.